Hello, it's Dr. Shelly, and we are about to kick some ass, take some names, and learn about some DKA up in here. Yes, let me tell y'all something. You know you have case studies on this NCLEX exam, and you know that there's a lot of really common case studies that might show up. So I already gave you one earlier, like the other day I did Addison's and Cushing's. Now today we're going to do DKA and HHS, but we are going to focus on DKA pathophysiology really well, and I'm just going to give you some case study love on top of it. Now I got to tell you something. A lot of times you guys put way more emphasis on the case study and not enough on the pathophys or the medications or whatever. And so I want you to know what I've learned over these years of the NGN NCLEX exam. The case study is not your issue. Your issue is the original test plan. So stay focused on what I'm going to say about DKA and then enjoy the little bonus kind of case study stuff, right? And I'm not doing a case study, but I'm doing case study type of stuff. What does that mean? It means that most case studies, somewhere in the midst of the case study, will see if you know the difference between two similar disease processes, okay? So DKA, or diabetic ketoacidosis, is very similar to HHS, or in some cases they may call it HHNS. HHS, Hyperosmolar Hyperglycemic syndrome. HHNS, which is what it was called when I was in nursing school, Hyperosmolar Hyperglycemic non-ketotic syndrome. You could even switch the hyperosmolic for the hyperglycemic and call it hyperglycemic, hyperosmolic, whatever. The point I'm making is that these two conditions are all about high blood sugar. Now remember what we said. We said cold and clammy, give them candy. So that was the sweating, shaking patient who had a low blood sugar. Cold, clammy, wet, diaphoretic, sweating, perspiring, low blood sugar. No, that's not happening here. So really big as you can stand it. Warm and dry means your sugar is high, okay? So know your little rhymes. Get your Jay-Z rhyme on, y'all. Get it together, because y'all be fucking that little part up. And I mean, we ain't even got started with the lecture yet. So I'm just trying to get you together, okay? Come on, let's go. Now, so here we go. We're going to start off with DKA. And what I always do is I tell you, when you take this test, make sure you don't get to that question and say DKA. No, you say diabetic ketoacidosis. And I'm glad that just happened. I dropped my little paper because I always forget to tell you like what handout you need to be looking at. When you're in my class or you're taking me like, you know, doing a self-study with my videos on HETV, because I have every subject, well over 500 videos. If this is you, you probably already know, we have a handout for every single video there could ever be, right? So this one is out of your diabetes. And when we go and we open this up, you're going to head on over, like across the street, you know, double over here. You're going to head on over to diabetic ketoacidosis, and there will be some comparing and contrasting on the last page of the two conditions, and you can add flavor or whatever, okay? So just thought I'd point that out, because we always have a handout for everything. And you know, if you already have my pink packets, you will be more focused on making sure you know that the Oh My God packet is your study guide to teach you how to pass all of this stuff. So enough said about my crap that I have. Let's get into the crap you gotta know. Here we go. So I told you that diabetic ketoacidosis, or DKA, needs to be said almost out loud at your test so that you understand the very big meaning between these three words. But what I've done on the board is I've given you 3 D's, because she loves the D, honey, baby, and 3 K's and 3 A's. And that's going to help you remember. I'm not a big person when it comes to like mnemonics, but I do think a little bit of helping you organize your thoughts in a rhythmic way or musical way does help. So that's why I gave you 3 D's, 3 K's, 3 A's. So let's find out what I did with my 3 D's. Diabetic. When you say the word diabetic, you must think to yourself, oh, yeah, I would never confuse this with a low blood sugar, because the word diabetic means what? High blood sugar, right? So therefore, you would never get anything wrong on your case study or on your test and mistake this for low blood sugar, because it's crazy to do that. The next D is for the word dependent. You need to remember that this patient is insulin dependent, called type 1, whole nother name for it, type 1 insulin dependent diabetic. And that's going to be a big difference, because typically DKA is type 1 and typically HHS is type 2. Okay. The next word is dehydration. Dehydration for the third D means a lot. It was caused by polyuria, in the sense that this patient is peeing out 5-10 liters of urine a day. And to put that in perspective, you and I pee about 2 liters a day. Not even sometimes, like 1.5 to 2 liters a day. This one's put out 5 to 10. When you are urinating or having polyuria like that, yes, you're losing fluid, and yes, your ass will become dehydrated. I think you know that that's not a no-brainer, right? That's a no-brainer. Now, what happens with the dehydrated patient? I need you to hear me on this. This is really important. When your body is dehydrated, your blood pressure drops. And if you were up here in Cleveland, you already know what I'm about to say, don't y'all? No BP, no PP, right? Let's talk about how that unfolds. So blood pressure, no blood pressure. Okay, that means, watch this, the pressure it takes to push blood through a blood vessel. You don't have any blood pressure. It doesn't need any blood pressure. There is no blood pressure, because what controls blood pressure? 2 things. Either vasoconstriction, or closing of the blood vessel, making you need more pressure to push the blood through that skinny, tiny, really vasoconstricted blood vessel, or vasodilation, so big open blood vessels don't require a lot of pressure to go through them. In this case, it has nothing to do with vasoconstriction or vasodilation. It has everything to do with the second part of the process of controlling blood pressure. Blood pressure is also controlled by blood volume, or the volume of fluid in the blood. So if you have peed out all your fluid and you're dehydrated, you don't have any fluid, so you don't have any blood pressure. To make it worse, you're peeing and you're peeing and you're peeing and you're peeing. So the sign of no PP, and that's why you don't see it up here, the sign of no PP is not going to be seen in this patient, because even though you and I say no BP, no PP, no, this one will have no blood pressure, and it's even going to kill their kidneys and cause acute kidney injury. It can even do that. Kidney collapse, vascular collapse, it can do that. But initially, you'll never know, because the traditional symptom of oliguria from a low blood pressure hurting your kidneys, no, you're not going to see that, because this patient has polyuria, not oliguria. Okay, so just kind of know that. So if you're thinking, oh, Dr. Shelley said no BP, no PP. I did in the traditional patient. This patient is still going to be peeing up liters. So don't let that fool you. The blood pressure that's low is still going to cause organ failure or kidney failure if you're not careful, because you need blood pressure to blood perfusing kidneys. Okay, now, so what could it do? What could this dehydration, this severe dehydration, lead to? Oh, that's easy. You know it too. Hypovolemic shock. Ooh, all shock has low blood pressure. So that just makes sense. Okay, I hope you're listening. So what'd you learn? 3 Ds in DKA. Diabetic, meaning high blood sugar. Dependent, insulin, type 1. You have to have a patient with type 1. You don't usually see this with type 2 ever. Dehydration, meaning your blood pressure's low. You might go into hypovolemic shock. Oh, and don't forget, get this, warm, dry, and flush. What did we say? We said warm and dry means sugar's high. So dehydration, you are warm, dry, and flush. Don't think pale, think flushed. Warm, dry, and flushed. Okay, so you're good with that. Let's do the 3 Ks, shall we? Remember what you said, diabetic, ketoacidosis. Let's tackle the ketones. Let me tell you about these ketones. The patient with type 1 diabetes, their body doesn't make insulin anymore. So the beta cells of the pancreas went on vacation permanently. The problem is this shit happened all of a sudden. Most of the time in children, teenagers, and young adults, but DKA can happen in anyone. When it happens all of a sudden, and it's as if your pancreas went on strike and said, fuck you, right? So your pancreas went on strike. It's not making any more insulin. Your body is like, what is wrong with you? First of all, the brain needs insulin to be able to utilize oxygen and to be able to work. You know that. And it can't use like stored insulin. Your body, your muscles needs insulin so that you can, what do we call insulin? The key. It needs insulin so it can unlock the cells and let, glucose in, so you have lots of energy in your muscles and strength and okay, so this person's exhausted, right? Fatigue, lethargic, malaise, all that shit. Okay, so we need glucose for our muscles. And then the third reason we need glucose is because while you're sleeping tonight, your liver takes the glucose and stores it as glycogen, and then it uses that glucose or glycogen as a source of energy while you're sleeping. I mean, you knew that. So the fact that we are not getting any glucose to our brain, any glucose to our muscles, no glucose for the liver, means that your body has thought that you lost your mind. Your body thinks you have gone crazy. It is so desperate for you to give it some sugar. It has a couple of things that it does. Get this. You knew this. You knew that the body did 3 Ps, and that's going to lead us to those ketones. So watch this. You knew the 3 Ps. One of the 3 Ps is polyuria. You got to know some very difficult $4 words. Polyuria, said a different way, is osmotic diuresis. Diuresis means peeing. But what does that osmotic thing mean? Osmotic means concentration, thickness, viscosity. So if I were to draw my blood, take all the fluid out the blood, you'd have one big nasty looking clot, right? It'd be really thick, real viscous, hyperosmolar. hyperosmolar, hyperosmotic, super concentrated. And in this patient's case, they do have that, but they have it with a lot of sugar in the blood. And I don't know about you cooks out there, but you know that sugar is sticky. And I mean, you can even make like a syrup or whatever with it. It's thick, it's viscous, it's concentrated, it's osmolar, hyperosmolar, more than 300. You get my meaning? So in order for your body to get that sugar out of the blood, it lets all the fluid that it can just go and dilute this sugar, and it's picked up by the kidneys. All this fluid that you put out to dilute the sugar in the blood, it's picked up by the kidneys and peed out. And you have so much sugar that you need so much fluid that you keep peeing it out that you get polyuria. Okay, stay with your girl. You are also, because of this hyperosmolarity or thick, viscous, sticky blood, hyperosmolarity greater than 300, you are also very thirsty. Like you are drinking any and everything. And usually the problem is with all this drinking that you're doing, you're drinking sweet shit. Yeah, my patient, because remember I was a provider before, I'm retired and now I teach. My patient, her ass, she was drinking fruit punches. Gallons, you know, Dairyman's fruit punch, that syrupy sweet shit. She was drinking it by the gallon. So she was just making her sugar go real crazy. But this is what the patient's doing. They're super thirsty. Because, I mean, they're losing their water, right? They're thirsty. Okay, this is where the ketones come in. I told you DKA, you on the ketones, stay focused. Here we go. Because your body is not getting any sugar at all, or at least it perceives it's not. You're drinking Dairyman's fruit punch. Of course you're getting sugar, but your body can't put it in the cells, can't give it to the brain, can't send it to the liver. So it's perceiving that you're not doing shit. Like you on some bullshit. You must be fasting or something forever because you ain't fed me and I don't know when. Like your body is like, you're not feeding me? Like what the fuck did I do to deserve this punishment? Like can you at least eat? So your brain has something called a hypothalamus. It is triggered to send your little ass hunger signals because you on some trash. You're not feeding me. It's desperate at this point. So it's sending out the signals to the hypothalamus like, bitch, eat, please. It thinks you're not eating and you're not listening. So things get real desperate. You know how desperate they get? Guess what, y'all? Check this out. Your body is so desperate because it thinks your dumbass is not eating, not sending it sugar, not doing anything because it can't use it, doesn't have the key, the insulin, which is the key to unlock the cells in your muscles, your brain, and your liver to get this sugar in. Your body is so desperate. It decides to do a little lipolysis. That's a fancy word, isn't it? Yeah, it's kind of fancy. Watch what I do. Lipo. You know what liposuction is. Your ass knows what liposuction is. That's sucking up the fat. Lipolysis. You know what lysis is. Sure do. You know there's a lot of words on your test with lysis in it. Tumor lysis syndrome. Rhabdomyolysis. This right here is lipolysis. You are destroying fat. You are literally going after this patient's fat, which is very often in the abdominal area. You're going after this patient's fat wherever you can find it. You are destroying it because here's a little secret, and then you'll know why there's so much obesity in America. Sugar is stored in fat cells. Sugar is stored in fat cells. Oh my God. So your body is so desperate that it starts to eat its own fat to get the sugar out. This digestion and lipolysis that's going on with fat cells gives you ketones and weight loss. So now the patient's losing weight. They are starting to have ketones in their urine, because when you break up fat, when you digest fat, when you tear up some fat, you get fatty acids and ketone bodies. And these ketones are a form of acids. And now you know where we're going, because acid was part of DKA. Diabetic ketoacidosis. Where the acidosis come from? Them damn ketones and fatty acids from you breaking up the fat. Makes sense, okay? Now, I want you to remember that I said sugar is stored in the body as fat. I desperately need you to remember that, because that's why people was losing weight with the keto diet. That's why yours truly over here eats very few carbs, because I know unless I want to have a big belly and gain weight, I need to cut down the carbs. Carbohydrates are sugar. Sugar is stored as fat. Yeah, put that damn Snickers bar down and don't even think about that donut and stop fucking with lattes. All right, I'm gonna continue over here because I know you're desperate to learn the rest. So we have diabetic ketoacidosis. I told you got 3 letters for each one. The ketones that we're working on right now is directly related to digestion of fat. What is it going to look like in the human body? Well, first of all, it's in the urine. Second of all, your breath is fruity, like you done took some juicy fruit gum and chewed it up. Fruity breath. You're not going to forget that your lips are cherry. I ain't got my real bright red lipstick on today, but if I did, I'd be like, cherry lips, okay? Now remember, cherry is a type of fruit. Cherry lips, fruity breath. You got me? Okay. Now, another K that you better be worried about, and I swear on everything holy, your ass better know this. The next K is potassium. Woo! You know, every time we talk about potassium, life and death comes into play. You already know whether it's high or low, your little ass might die, okay? So what do you have to know about the potassium in DKA? You must know that it's usually always abnormal. Most of the time it's high, but it could also be low. You just need to remember it's always abnormal, and it has the potential to become even more abnormal. And because of that, K, you know I teach you EKG. EKG. Yeah, I still call it EKG. I don't care if you call it ECG. I'm old as hell. I call it EKG. Okay. Now, so the patient needs an EKG and they need you to monitor for this potassium. Your doctor knows that. They're going to order that whole basic metabolic panel repeatedly. They're going to get a potassium level all the time. There is so much stuff that you got to do with this patient that can affect her potassium. So just stay tuned. The next K is Kussmaul's. Woohoo, sounds bougie, doesn't it? Bad and bougie. So Kussmaul's is rapid and deep breathing. Watch. Now, why would I be breathing like that? And when I am breathing like that, what am I blowing off? I'm blowing off what? What is it? Think about it. What's coming out of my mouth with expiration, exhalation every time I... CO2. Yeah, we breathe in O2, we breathe out CO2. CO2 is an acid. I am already in acidosis from the ketones. Because I am in acidosis from the ketones, which is metabolic, you got to go back to what you remember about acid base. Remember learning that when the body is in metabolic, anything, which is kidneys, that the lungs try to compensate and vice versa. If the body is having problems with acid-base balance from lungs, then the kidneys try to compensate. So watch this. You are in acidosis. You are now showing Kussmaul's breathing, which is rapid and deep. You are compensating for the metabolic acidosis by trying to blow off CO2 and get rid of that acid to compensate your pH. The acidosis that you are in, the pH will be low. It will be less than 7.3 in this case. It will be less than 7.3. Acidosis, pH, less than 7.3. And your bicarb in the DKA patient will be quite low, less than 18. And you remember bicarb is 25 plus or minus 3. So normal bicarb is 25 plus 3, which goes all the way to 28, or minus 3, which is what? 22. So you got this. So 22 to 28 is normal bicarb. In this patient, the bicarb is less than 18, which is a true essence of metabolic acidosis. Remember what bicarb is. It's base. You have acid and base. You have low base, high acid from the ketones. Acidosis, metabolic, okay? All right, you're doing good. Now, what's the other A's? Because I told you I gave you three D's, 3 K's, 3 A's. The 3 A's, aggressive fluid replacement, is your first nursing action. Of course, you check the blood sugar, but I mean, come on, we already know that the admission diagnosis is DKA. So you, my love, are giving a fluid bolus yesterday, 2 liters, normal saline yesterday, I said. Open that motherfucker up. How open is it? Well, we know that we place our normal saline, 1,000 milliliter bags on a pump, put that motherfucker on 999 and set that shit, bolus your patient. 2 liters yesterday, now, immediately, ASAP. I don't know how much more I can say about that. If you fuck this up, and instead of giving them the bolus first, if you mess this up and your crazy behind go and shoot for an insulin drip as your highest priority in treatment, don't worry, we're gonna get us full of insulin drip. But if you did that first, don't forget your pathophysiology. Insulin decreases potassium. So you just killed your patient. Do you know what the number 1 cause of death of DKA patients is? Sometimes it's the fact that the nurse didn't know her priorities, that the priority is push fluids, IV fluid bolus. Because she was concentrating on the insulin drip and not paying attention to the fact that the fluid bolus should come first. Now let's look at this. You have an aggressive fluid replacement, IV fluid bolus, normal saline, 2 liters within a half hour to an hour. Then you have to worry about this insulin drip, and you're trying to run this insulin drip. Your doctors usually like the blood sugar to come down a little bit to 250-ish, depends on your doctor, but once the blood sugar comes down to about 250, they will very often hang sugar, D5, normal saline. They will hang that bag with sugar in it. They'll start coming down on the insulin drip. They'll start giving potassium replacement, or KCl, potassium chloride. Look at this. As you give insulin, potassium will drop. It will drop so much that you are monitoring the potassium very closely, because potassium chloride replacement might be necessary if it dropped a lot. And it does drop. I swear to God, I've seen it. It drops. And if it's dropping because insulin causes that, that's why you end up with a little KCl hung up on the daggone pump as well. Now, I see so many videos out on this, and they talk about how this is an ICU patient. Well, that's true, but then they're transferred to the floor on an insulin drip. So you got to know this. I've seen it. We don't do insulin drips on the floor. Yes, you do. Okay. Now, I hope that made sense, because now this should make all the sense in the world. We're going over to tell you how to handle maybe a case study with 2 different diseases on it, and you're trying to figure out what does this patient have, you know, prioritizing your hypothesis. So I'm going over here to help you prioritize your hypothesis. Here we go. You know what prioritize your hypothesis is, right? That's part of the clinical judgment, fool. That was all part of the case study measurements. Like, they measure that stuff on this test. Okay. Okay, so here, watch this. I like charts. Charts are good here. DKA versus HHS, which is also called HHS. This spelled out as hyperosmolar hyperglycemic syndrome. Type 1 diabetes, type 2 diabetes, or get this, no diabetes at all, never been told they had diabetes, never been on insulin, just sick as a dog and ended up with a high sugar. That happened to my best friend when she got COVID so bad. Her sugars were off the chain. She'd never been told she was diabetic. High blood sugar, greater than 300. Oh, no. HHNS is extremely high blood sugar, greater than 600. The highest was 1400. You already know what that means. Large ketones, no ketones, or maybe a tiny amount just because you're dehydrated. But usually you don't see ketones. The pH is less than 7.3 with DKA, and you are truly acidotic, metabolic acidosis. The pH here is greater than 7.3. There is no acidosis. In fact, the pH may be normal. Positive Kussmaul's, because you're compensating for metabolic acidosis by using your lungs. Because there's no acidosis, there's no Kussmaul's. DKA happens all of a sudden. HHNS is very gradual, very subtle, sneaks up on you. That's why we're going to have a problem. Some of these patients are undiagnosed diabetics who find out that day that they have type 1 diabetes. That's for DKA. This patient, HHS, has usually 90% of the time pre-existing diabetes, and it could be pretty bad. If they don't have pre-existing diabetes, they have no history of diabetes ever, and they're super sick, and we are getting sugars of 6 and 7 and 800. Now remember, the AccuCheck only goes up to about 500, and when it does go over 500, it'll have a big old H on it for high. It don't even tell you what it is, so you got to wait till the blood sugar, well, you don't wait, but the blood sugar will come back from the lab and give you some idea of how fucked up it is, right? Okay, now watch this. This DKA happens all of a sudden, so typically the patient is still alert and oriented, not always, usually. The patient with HHS very often, because their sugar is really outrageously high, and plus they're super dehydrated, very often is confused with altered mental status, and sometimes they're admitted in a coma. DKA can kill you, but it's not as deadly. HHS is extremely deadly, with 10% of people with this condition going to die, pretty much guaranteed. The bicarb is not normal with DKA. It's less than 18. For HHS, it is higher than 18 and typically very normal. There is no acidosis. DKA, you usually, I said this before, usually have a previously undiagnosed diabetic. For HHS, you have a diagnosed type 2 diabetic who is very sick, and they either have a fever, some type of infection. With my very best friend, it was COVID, some type of serious, chronic, horrible illness that has gotten really bad. Maybe even this is an MI patient or a stroke patient, or a patient with a pulmonary embolism. For this patient, the DKA patient, there can also be stressors like surgery or illness or any of these other things, but not as much. For this DKA patient, oh, by the way, the HHNS patient, pancreatitis is a very common reason why they might be an HHS, so just know that. The DKA patient can be children, teenagers, young adults, college kids, or any age, but they can really be young. For HHS, this patient's usually elderly. Yep. And they're definitely over 50 or 60, okay? You know, stay there with me. For DKA, there is nausea, vomiting, fruity breath, abdominal cramping, cherry lips, all from ketones. And with HHS, there's none of that. There's one more difference that I really want you to understand. HHS has that $4 word, hyperosmolar. Ooh, I need you to know that blood osmolarity higher than 300 is hyperosmolar. The patient with HHS has way more osmotic diuresis, meaning loss of urine fluid, causing them to have much more thick, viscous, concentrated blood. And watch this. During the time that they're experiencing this HHS, they can throw clots, because we tell you like this: thick blood, concentrated blood, viscous blood clots very easily. Remember that if you were to throw a clot, an MI is a clot in the coronary artery. A stroke or CVA is a clot in the cerebral or carotid artery. You could even have a clot like a DVT, pulmonary embolism, or in a peripheral artery, because this blood is so thick. This is why this patient's at much more higher risk of dying, because they could be throwing all this shit on top of a blood sugar of 1,000 or 800 or whatever. So you can see these two things share a lot, but they also have some big differences. You know, they're going to share, for example, they're going to share polyuria. They're going to share polydipsia. They will not, however, share polyphagia. They will not share the weight loss. They will not share the ketones, because the HHS patient makes insulin still. So they never get so desperate that they're eating their own fat and losing that fat off their body. But the DKA doesn't make any insulin. They're desperate, so they will devour lipolysis. They'll devour their own fat. Now, I'm tired. I'm going home. I'm like, you know, working 24/7, 365. I'm really tired of y'all. Y'all cute and all, but I'm tired. Deuces. Like, you notice how that deuces wasn't even like real pumped. Deuces. Okay, fine. Deuces. I'll see y'all later. Love you.